Hi, I'm Dr. Noah Erickson, Clinical Director of Innovative Family Wellness in Wexford, Pennsylvania, and Boardman, Ohio. Tonight we're going to talk a little bit about epigenetics. Recently this topic has been in the news quite a bit as people want more and more of what's called functionalized medicine that goes hand in hand with personalized medicine. In other words, you want to go to your doctor and know if the type of vitamins that you're taking are appropriate for your body, if the diet you're eating is appropriate for genetics, and how to optimize your health. So what we're going to do here is turn to our email bag and also take a few of the most recent questions that we got called into our clinic and address those tonight. So we're going to turn to our moderator, Jody, who's going to ask a few questions.
Dr. Erickson, we've been getting a lot of emails recently regarding specifically 23andMe genetics tests. Can you tell the folks how you were able to use that in your practice?
Sure. Over the past few years, a test has become very popular, a test of the saliva called 23andMe. That test looks at little parts of our genes that have errors in the metabolism. And what we're able to do with this is customize someone's vitamin plan and make specific recommendations that greatly influence their health. For example, a lot of people know of a SNP called MTHFR. This SNP directly controls folic acid metabolism, and there's a few other ones that go together known as the methylation cycle. In other words, we're all interested in detoxifying, how we can become healthier, live longer, have more energy, and there's a lot of interest in this area right now. So what we do is interpret this test and make specific recommendations. In other words, we give you further treatment options for your health conditions.
Dr. Erickson, a lot of the people that are emailing and calling have children who are on the autism spectrum, and they're wondering if this test could be beneficial for their children as far as the treatment.
Indeed. So many of the parents out there looking for a supplement program ask, am I taking the right vitamins? Or why did this vitamin cause my child to have excessive energy, stimulation, detoxification? And what happens is we dump these vitamins into our children, vitamin B6, B12, folic acid, omega-3, with the best expectations and hopes. Although in some children, this doesn't work. Perhaps they actually have an exacerbation of their current symptoms. Maybe now they're not sleeping well. Perhaps they have an exacerbation in a behavioral condition. So what we do is customize their programs by running various tests, such as 23andMe, to identify the specific nutrients that'll work best with their bodies. Many parents are finding this extremely helpful because now they feel they're not just throwing away money at the next latest and greatest supplement. Perhaps they hear about broccoli seed extract or the benefits of methyl B12, but we can actually identify exactly what type of B12, what type of folic acid, and completely take the guesswork out of the program. So what we're doing now is enabling children to go on plans customized to their genetics, and we use biochemical testing like stool testing, hair, urine, blood, saliva to complement this test known as 23andMe.
I understand there's a lot of adults with chronic illnesses that could benefit from genetic testing as well. Could you elaborate on that?
Yes, indeed. First of all, we hear that gene MTHFR, to revisit that again, and so many adults are worried about cholesterol and the risk of dying of cardiovascular disease secondary to complication. So we certainly want to look at our folic acid level, an inflammatory protein in the body known as homocysteine. And this little chemical can be actually controlled by using dietary measures, such as B12, folic acid, and B6. But again, we need to know, do we have this gene and what type of nutritional supplements to use? So for my patients with Lyme disease, chronic fatigue, restless leg syndrome, we can actually now identify the specific nutrients, taking out the guesswork and making their plans most customized to accurately treat their condition.
What are some examples of some of the chronic ailments or illnesses that you feel could benefit from this type of testing?
Yeah, there's a host of conditions, and probably the buzzword to sum this up is inflammation. We're finding now that most of the conditions of the body, be they blood vascular conditions, pulmonary conditions, neurological conditions, musculoskeletal conditions, have an underlying component of inflammation. So we're trying now to control a histamine chemical. We're looking at identifying factors to reduce ammonia in the gut, these toxic chemicals that make our bodies feel sick. They give us brain fog, everyday mental malfunction, chronic fatigue syndrome, aching joints and pain. So what we're enabling our adult patients to do is look long-term into the future and put off these type of dramatic conditions and eliminate their side effects by using genetic medicine.
Great. Thank you so much.
Thank you.